Gallery. Art would like to make some comments.
Thank you, Nigel. And I was, as I was pinch hitting for Flora Castillo earlier, actually this time I'm pinch hitting for Rich Weaver, another APTA colleague. So happy to be here nonetheless. And Vince, hello, Vince Valdez. I mentioned FTA colleagues, and I overlooked you there. I have also a notebook full of notes, but I'm going to boil it down to 3 questions. And I think I'll ask them all together, and then pause and let everyone pick and choose and weave together their responses on it. And the first one is on new mobility systems. And I really want to probe at the transformational aspect of it. Things are happening fast, and we need to be thinking and acting fast accordingly. And I will say one thing in a factual way: follow the money, right? I saw on the front page of the Wall Street Journal a weekend or 2 ago, in just one of many, many articles, but Apple putting $1 billion into a Chinese company, the Uber equivalent in China, called Didi. And there is things like that happening every day. So people are betting with their wallet that this is going to be a big factor in the future. So as we look at the transformational aspect, and it's not all about Uber and Lyft, right? There's technologies changing all kinds of things here. And again, eventually automated vehicles are going to be very prominent in this space. So I mentioned earlier, and it's a tough problem, all this coordinated services here. How can we really be ahead of the curve rather than be following the big money players here in the changing mobility? So that would be question number 1. Question number 2, the question came up after Heidi's presentation about land use. And I think it was sort of saying there wasn't much discussion about land use in the survey that Heidi did. And I mean, right? I mean, are we going to build these places, and the only way to get there is by cars? And the trends are going towards mobility, broader terms of mobility here. So we have to locate healthcare in places where they can be accessed, right? So I want to underscore the access question. That would be point number 2. Point number 3 would be, in my world, public transit. We've made a big thing over the last, say, 20 years about connecting transit to airports, and cities have reacted to that, saying, we want an airport connection. It gives us, our city, standing. It helps our convention trade. The Convention and Visitors Bureau say the same thing. We want that connection with the airport. And we've tracked that. And one by one, and I could recite them, the cities and how they connect to their airports, not just by rail, but in high quality ways. Some have started to do that for health. In fact, Cleveland built, and it wasn't a rail line, it was a bus rapid transit line, and they call it the health line. The health line, because it connects to their health facilities. So I think in terms of data, statistics, branding, I say, how can we maybe, and I'm the transit guy asking you, but your perspective would all be helpful. How can we enhance the branding of transit and health? Is just like, again, like in airports, it's known better and better. When I go to a city, I get to wherever I'm going by transit, because it's sort of branded, and the information desk says it. Anyway, end of speech on that. But so 3 general questions: 1 on shared mobility, transformational aspects of it. And Mary, you and Catherine did talk a little bit about that in your own talks. 2 would be on land use and location. And 3 would be on branding transit connections to health, just as similarly, perhaps, as we do with airports. Thank you.
I'll take a stab at the land use, since I'm part of a planning organization. And there is a big emphasis on where I work in aging, and there's a whole movement around land use, housing, transportation, and healthcare, and access to services. And with our changing demographics, with the whole world and our country becoming much more people living longer and having a bigger cohort of older people, it's even more critical that transportation and housing and healthcare all be connected in land use. And how you do that is you know, I think people follow the money. Developers go to what people want, and they've been branding it as new urbanism, livable centers, what AARP is doing with their livability index. Consumers are asking for more walkable, livable communities, and that's what you really mean when you talk about having transit and housing and healthcare all connected. So I see the trend. I think the consumers are going to demand it.
Any other responses to Art's 3 questions or themes from the panelists? Anne, I don't want to forget about you being not physically up here, but connected with us as well. So if you have any input, please provide it. Catherine?
I have a few comments, but with regard to the land use question, there are definitely some places that are looking at shared mobility in lieu of parking. Primarily in San Francisco. Of course, San Francisco is sort of the epicenter of where all of this is happening. But there was a condo, for example, that was for sale last year that provided no parking whatsoever, but that did provide unlimited free Uber rides for the first year that you were living there. I'm a little confused about the logistics of exactly how that one worked, but it was highly prominent in the for sale listing. There's also a few developments in the San Francisco area that are providing, again, in lieu of parking, $100 vouchers for transit, and Uber, Lyft, et cetera, are included within that transit for all the residents if they don't bring their car. So there certainly are some groups that are looking at this. Car sharing and bike sharing are also becoming popular amenities for new developments, specifically in urban centers. But a lot of new residential developments are providing specific car sharing spaces in their parking garages, for example, to make it every bit as convenient for a resident to use a car sharing vehicle as it is for them to have access to their own vehicle. With regard to branding of the transit and health, Uber and Lyft, again going back to those two, are very, very good at the discount code system that is out there. They love to provide discount codes for people to have free rides if they've never used Uber or Lyft before, with the theory that once you use it once, you will be absolutely hooked and just can't wait to keep making it a part of your life. So far, most of those discount codes have been applicable at major conferences and festivals. South by Southwest is one place where it's almost becoming silly to provide those discount codes for first users because there are so few people attending those conferences that have never used Uber and Lyft before. But there's the potential for them to partner with hospitals, for example, or dialysis centers, and say that for a dialysis patient, you may have never used this before, you may have heard of it and be a little confused about how this whole thing works, but here, try it for free. Try your first couple of trips for free, for example, and start making it just a regular part of the trip to the dialysis center or to the doctor or whatever it may be. And as far as being ahead of the curve, a lot of that will come down to the regulatory regimes that go into place. These systems, specifically Uber and Lyft, it's less of a problem with the car sharing, bike sharing, and microtransit, but Uber and Lyft have a tendency to operate in cities regardless of what the existing regulatory schemes may be. Some of it comes down to enforcement. Some places are better at enforcing those requirements than other places are. But creating regulatory policies that are in everybody's best interest as opposed to those that are largely mirroring the status quo for the transportation industries that already exist, specifically taxis, and providing flexible but guiding regulations, I think, are going to be key. Some cities are definitely moving in this direction. Some cities have, for example, required that Uber and Lyft not necessarily provide wheelchair-accessible vehicles themselves, but that every ride have a fee of 10 cents to $1 attached to it, and that fee goes into a central city fund, which then buys more wheelchair-accessible vehicles for either the paratransit system or for taxi industries. So there are ways through regulations and policy to create some more partnerships. It is not always the easiest thing in the world to partner with the gorillas that are in the room, but if cities are willing to make some compromises, Uber and Lyft have occasionally been willing to compromise themselves, and those partnerships can be beneficial to the public health world.
Okay, thank you. Let's thank all the panelists and discussants again.